Today I'm going to talk about my epilepsy, the late diagnosis of epilepsy, and how it impacted my mental health. So, like I said yesterday, I was diagnosed when I was 15 in March 1999. But look, when I was looking back, before that, it looks like I had seizures before that, and that could be contributed to epilepsy, but we just didn't know it at the time. So I had a couple seizures called febrile seizures, which is a seizure that comes along with having a fever. And I also had what are called absence seizures, which look like you're looking into space, and my family would go to the accordion and I would respond. So I had 14 years of life without the diagnosis of epilepsy. So there was grief and anger and disappointment because it took away so many freedoms that you don't even realize the freedoms when you don't have epilepsy. Like being able to swim without somebody watching you closely, driving without somebody being in the car with you. Like, those are just two examples. Not having to worry about choosing between going to dance or not going to dance because that could be strobe lights. It's not having to stay in the school during a fire alarm going off because of the strobe lights on the fire alarm. It just made me feel even more different than I already was due to my learning disability. And it added to my already existing PTSD, even though I didn't know it was PTSD at the time. I just knew that I was wanting to avoid as much as I could going to Florida on trips to visit my grandparents because I don't like the experience of being there and waking up in the hospital and having the doctor explain that I have epilepsy, which is a seizure disorder, but no explaining it past that. Medications that you get put on. With my current seizure medication can cause depression and suicidal thoughts, and it's so hard because I just want to be like everybody else. Everybody without epilepsy, I want to be. But at the same time, I would not give it up because it's made me who I am. But that doesn't mean it doesn't affect my mental health. That doesn't mean that I don't get discouraged when there's waiting that has to be done because of a doctor's office not responding as fast as I want them to respond because of having to switch medications or having to set up an epilepsy monitoring unit stay. I experience all of those on such a deep level that it is so hard to explain. And then it creates So I have to take medications for depression and anxiety and ADHD and any other conditions that might come up. And it just makes life so much more difficult because every time you get prescribed a new medication, you have to look at the prescribing information and see if it says anything about seizures. And or if you have a history of seizures. Um, and that's another thing. Like, I see a cardiologist. Um, and that cardiologist office had me do an inhaled stress test, and I had a seizure at the cardiologist's office and had to be taken to the hospital because they weren't supposed to do that on somebody with a history of seizures. And I didn't know that. They should have known that. And I'm not trying to bash them, but it annoys me that I have to be so proactive. And now I have to ask every single doctor, can I do this procedure? Is this okay for me? Or I or hope that they tell me, like, I can do TMS, but I can't do it until my seizures are under control because TMS can cause seizures. And it just complicates so many things. Like my medications, like my primary care even told me that there's other medications that they could try to prescribe for my stomach pain, but they can't because of my epilepsy. And so epilepsy complicates things so much. And that is knowing that adds to the already difficult journey of mental health that you deal with on a daily basis with epilepsy. I will talk to you again tomorrow. Thanks. Bye.